Hello, everybody. We're going to go ahead and get started. I want to welcome you to the 11th meeting of the CSG National Long-Term Care Workforce Network. I'm Sean Sloan. I'm a senior policy analyst at the Council of State Governments National Headquarters here in Lexington, Kentucky. So here is our agenda for today's meeting. I'll have some introductions and a bit of a project recap. We have an exciting update on something I spoke about last month, and then we will turn to the great panel that we have assembled for today's webinar. We're going to get an update on the work of the Moving Forward Nursing Home Quality Coalition. In order of appearance, we will hear from Dr. Jasmine Travers from the NYU College of Nursing, Dr. Betsy White from Brown University School of Public Health, a coalition chair, Dr. Alice Bonner, Jenna Kellerman, Director of Workforce Strategy and Development at LeadingAge, and Dr. Kezia Scales, Senior Director of Policy Research at PHI. Several of these folks lead or serve on the two workforce-related action plan committees that have been working with states to test and promote recommendations that Moving Forward introduced last July. Later on, they will take your questions. We encourage our attendees to make use of the Q&A and chat functions here in Zoom. And we encourage our guest speakers to take a peek in there when you're not speaking and respond to any inquiries if you can. But keep in mind that some of those questions the entire group might also benefit from hearing the answers to as well. Before we adjourn today, I will tell you about our plans for future network webinars. Just a quick project recap of how we got here in 2022. With the support of the Commonwealth Fund, CSG created an 8-state task force that guided us in the development of our long-term care policy guide, published early last year. One of the 3 focus areas we had for that project, which corresponds to one of the chapters in the guide, was revitalizing the direct care workforce and supporting family caregivers. Last year, again, with the support of the Commonwealth Fund, we spun off that workforce focus into a project of its own. We've expanded that 8-state task force into a national network of state policymakers and stakeholders that you are all part of if you are on our mailing list and if you are joining us today. We now have somewhere in the neighborhood of 500 on that mailing list. We have a website, our National Online Resource Center, which uses that section of the policy guide I mentioned to highlight numerous examples of state policies going on around the country. And we have been offering technical assistance to states that are interested in exploring ways to address long-term care workforce needs. This is where you will find the website, which we continue to update with new bills and initiatives being enacted in 2024. Well, last month I told you about an event I had the honor to attend in Honolulu in February. I was pleased to give a presentation about our state strategies to revitalize the long-term care workforce at a 2-day Hawaii Long-Term Care Summit. Hawaii was one of the 8 states on our original task force in 2022. So we have been working with many of these folks for quite some time. It has been great to work. They've been great to work with, and to get to know all of these folks in the Aloha State as they work their way through an ambitious agenda for long-term care. And I am pleased to announce that key parts of that agenda appear to have come to fruition during the 2024 legislative session. This is a picture from, I believe, just last week, as a bill to develop a long-term care master plan was voted out of conference committee. Our friends in the legislature, including Senator Sharon Moriwaki, who has been so instrumental in these efforts. They're all busy this week working towards sine die and the end of session. But we do have joining us, I believe, Caroline Catarau, Director of the Executive Office on Aging in the Hawaii Department of Health, who was on our 2022 task force. In the photo, she's 4th from the left there, next to Senator Moriwaki. Caroline, what can you tell us about the legislative accomplishments for long-term care during the 2024 session?
Aloha. Hi, Sean. It's Caroline. Yes, this is a bill. This is one of our pictures from last week. We had a lot that passed last week. We're very excited, but I do want to hone in on the 2 that are around moving long-term care forward. And Sean, thank you for sharing the pictures of our great summit that we had back in February. This bill that you're seeing here that was passed out of committees going to the governor, requires that the State Union on Aging, that's the Executive Office on Aging, in coordination with the State Health and Planning and Development Agency, is going to create a long-term care plan to accomplish long-term care policy goals. And it's also establishing a long-term care planner within the Executive Office on Aging. We actually had a planner position that had been abolished over 15 years ago. So this is very timely. Actually, probably should have had it a while ago, but with the work that we're doing around this comprehensive long-term care plan, the planner will be an integral part of all of that. So again, we're really happy that that passed and that we're going to be working with various stakeholders to move this forward. Yeah, many of our representatives and senators in that picture, and Dr. Jack Lewin and myself. The other one that I wanted to share was that we received an increase in our monthly needs allowance to individuals living in long-term care facilities. It went from $50 to $75. We have been trying to pass, not we, but the whole state has been trying to get this passed for many years. And it's something that has finally come to fruition. So we know that that's really going to help those in long-term care facilities to pay for various things that just a cell phone that's going to cover the ability for them to have a cell phone. So we're excited. We had a few other things that passed. It's not long-term care related, but I just want to share. We were the last state to, I think, implement a silver alert. So it's kind of like the National Amber Alert, but it will be for older adults with cognitive impairments and also individuals with disabilities with cognitive impairments. So if they do go missing, this will allow them to be able to put it out at like an Amber Alert. And we already have a Miley Alert, so we're going to use the same system that's already in place. We just need to just expand that. So we're really excited. It was a good legislative session considering the many things our state's grappling with, specifically the Maui wildfires. So excited, but thank you, Sean, for letting me share.
Thank you so much, Caroline, and congratulations to everyone in Hawaii who worked on these initiatives. And remember, you can still read my article about Hawaii's Long-Term Care Summit on the CSG website. So without further ado now, we want to dive into our main topic for today, which is getting an update on the work of the Moving Forward Coalition. It was almost exactly a year ago that the folks for Moving Forward joined us for our first webinar to discuss their efforts. Last July, Moving Forward issued a series of 9 action plans to address various issues facing nursing homes. 2 of those focused on workforce challenges, improving CNA wages and support, and expanding CNA career pathways. Jasmine Travers is going to kick us off with an overview of the coalition's project activities and timelines, and yield to her colleagues for updates on the CNA work, Medicaid incentive payment programs, and next steps. The folks from Moving Forward have also been engaged in other extracurricular activities as part of their day jobs, including congressional testimony and working on a technical assistance project for states. So we will hear about those as well. Thank you all so much for joining us. And Dr. Travers, please take it away.
Thanks, Sean. I appreciate your warm introduction. I'm just going to yield it to Betsy, who's going to kick us off. Sorry for that last minute change, but still the agenda for today. Thanks, Betsy.
Yeah, we played musical chairs on you, Sean. So next slide. Yeah, so we're gonna touch on a couple different topics today. Some are directly related to the Moving Forward Coalition work, and then some are kind of outside the coalition work, but which our members are involved with. So first, as Sean was mentioning, the focus of the coalition work, and specifically the Workforce Committee, which we all co-chair, is focused specifically on advancing certified nursing assistant career pathways. And then also kind of another thread of it has been looking at Medicaid incentive payment programs, specifically that have workforce metrics in them. So we're going to give you the updates on where the coalition work stands with that. And then Dr. Travers recently testified to the Senate Aging Committee regarding the new Long-Term Care Workforce Support Act that was introduced by Senator Kezia and colleagues. So she's going to summarize a little bit about that testimony. And then Dr. Scales is going to be talking about the ACL Direct Care Workforce Strategy Center that she has been involved with through PHI. So next slide. So we've talked about moving forward a few times with this group. So just a brief reintroduction to us. So we are a group of individuals and organizations that have come together to drive specific actionable improvements on nursing home quality while building a sustainable network to continue this work. And basically we are developing and implementing action plans to improve nursing home resident quality of life. Next slide. The guiding framework of all the work under the Moving Forward Coalition, which is divided across multiple committees, is the 2022 National Academy of Sciences, Engineering, and Medicine report on nursing home quality. And our, as part of the Workforce Committee, we have focused on the recommendations out of this report that were focused on workforce. Next slide. So this is kind of generally the timeline. So basically when the coalition first convened back in June 2022, the initial goal was just to kind of take apart that report, the NASEM report, and figure out, okay, what are one or two recommendations for each committee just to really be able to focus on. And then we developed action plans, and now we're in the final phase of the initial funding for the Moving Forward Coalition, which is where we're actually implementing the action plans. So next up. These are the members of our Workforce Committee. As you can see, a pretty diverse representation of perspectives, organizations, individuals. So it's been really fun having just, you know, lots of different perspectives as we've been thinking about this work. Next slide. So again, as I mentioned, our specific focus on the Workforce Committee has been the workforce recommendations out of the NASEM report, and specifically the recommendations that around improving wages and benefits for staff, but CNAs specifically, certified nursing assistants, and then also advancing the recommendation to advance the role and empower CNAs and improve their standing in nursing homes. Next slide. So we've talked a little bit with this group before about, you know, a lot of initially what we did was just kind of a scoping review to understand what's out there. And the key takeaways, there's lots of different kinds of pathways that are out there to support CNAs. There are those that support trainees as they're moving into the CNA certification. Some of those are done without apprenticeship. There are a couple of big programs out in California, the Gateway In program and the CNAP program. I see Claire Enright's on the call. Those are programs that support CNAs as they're going into certification and work with the state workforce development boards to provide wraparound services. There are also SEIU has a pretty replicable model across multiple states where they have done kind of a similar effort. They're supporting trainees as they're moving towards certification, but they do it under a registered apprenticeship framework. So there's a little bit more structure to it. And then there's also pathways for people who are already CNAs and are looking to advance within the CNA role. An example is in Tennessee, they have a micro-credential program that direct care professionals, including CNAs, can progress through and receive promotion as they do that. And there's a lot of kind of similar models elsewhere. Where we've focused as a coalition is this box in the bottom right. And that's how do we support career advancement for people who are already CNAs, but doing it under the registered apprenticeship framework to provide that added structure, the added wage progression, and to help CNAs receive a portable credential that they can pick up and go from one employer to the next and reap the benefit of going through this career pathway model. So this has been the real focus of the coalition. Next slide. So the work that we've done has kind of evolved naturally over time. The biggest piece of it has been that we've managed to convince the Geriatric Workforce Enhancement Program, the Geriatric Workforce Enhancement Program at HRSA, with their next funding cycle, which is going to start this July. All the GWEP programs are going to be required to actually build a registered apprenticeship CNA advancement model as part of their GWEP funding. And we're going to talk a little bit more about that because that's been a big piece of our work. Another piece of our work has been monitoring the Illinois, multiple states have Medicaid incentive payment programs that integrate workforce metrics. The Illinois program in particular has been kind of a unique program implemented recently that specifically has metrics to support advancement of this workforce. So Kezia will talk a little bit about that later. And then finally, we've just been doing a lot of kind of networking education with different stakeholders across different states. So what we sort of quickly learned is when you really want to focus on developing the CNA workforce, you are very quickly in the weeds of the state policy and practice environment. And that's why CSG is such a wonderful resource, and all of you on the call here, operating in this space. This is very much a workforce that, we have to address efforts at the state and the local level to support CNAs. So I'm going to turn it over to Alice. So next slide, Sean. And Alice is just going to give a couple of examples of some of the states we've been working with. There have been many others, but these are some of the more formal efforts. So Alice.
Great. Thanks, Betsy. And hi, everyone. I'm very glad to see a number of colleagues on this call we work with in states like Pennsylvania, Michigan, Ohio, California, and others. These are three examples where people actually reached out to us. And, sometimes we give talks and presentations and around the country, and there's a lot of people who know who we are and what we do, which is great. And in other cases, it's news to them. They don't really know about us. So we recognize that we are a new group, still only 2 years old. But this is an example where we're very gratified that people did know about us. So in the case of Oregon, they have a task force led by state legislators, and they originally reached out to us because they wanted information on what we're doing with ownership data and transparency. And then it sort of morphed into a discussion about workforce, and they were really surprised to learn, particularly about CNAs, certified nursing assistants, about, the low wages, compensation challenges, et cetera. And so then they invited us back, and Kezia and Betsy did more of a presentation just focused on workforce. But we continue to be in contact with folks in Oregon about that work. And then Ohio and Kentucky, we had outreach from, in Ohio, the State Division on Aging and Independent Living, also in Kentucky, the same type of organization where they brought together people working on the GWEPs, as Betsy talked about, a lot of the people who are on this call, people who are in state leadership positions in Medicaid and other agencies, and really trying to network and bring people together. So I've been on weekly calls with Jeff Wellman from NACA with Ohio, and we've been on sort of monthly calls roughly with the state of Kentucky representatives and their commissioner to sort of, help them to get the next phases of work going and really roll up their sleeves. So that's what we've been doing with those three groups. Back to you, Betsy.
Thanks, Alice. And, we've been talking to a lot of other states as well, and different types of stakeholders within states. I think the other really enlightening thing as we've been going through this work is just how many different people are in the ocean working on this kind of thing. And, within states, oftentimes there's multiple efforts and they're not well integrated with each other. So some of what we've just been doing is just kind of educating and, making connections within states, one of the real advantages of the coalition, again, is just kind of the diverse stakeholders that are represented. So there's been a lot of opportunities where we've just been able to do, more handoffs, introductions to kind of network people in. And there have been a number of kind of efforts that have evolved from that. Next slide. So so coming back to the Geriatric Workforce Enhancement Program. So again, those of you who aren't familiar with them, these are funded through HRSA. to support workforce training for community-based organizations that care for older adults. So a lot of these are universities, schools of medicine, schools of nursing, but it's there's also some FQHCs. There's kind of a variety of different GWEP awardees. There's currently 48 GWEPs across 35 states, Guam and Puerto Rico. That's for the current funding cycle, and as we mentioned, with their next 5-year funding cycle, so the applications are under review right now. Each GWEP is going to be responsible for building out a registered apprenticeship to support advancement of direct care professionals. And why this is kind of a really unique thing, and why we're excited about it, as I mentioned initially, when we were doing sort of the initial scoping review and just figuring out this landscape, it's a huge mix of lots of pilot models that don't really scale, and just lots of variation. And the one thing about the GWEPs is that they can learn from each other, and there's some structure there. So it's called the GWEP Coordinating Center. It's also funded through the Hartford Foundation, similarly to Moving Forward Coalition. And the GWEP Coordinating Center sits under the American Geriatric Society. And they have like annual meetings, actually twice-a-year meetings with all the GWEPs. And it's a learning community. And they have used the GWEP Coordinating Center previously to stand up age-friendly health systems, to kind of reinforce and share best practice models. So it's this idea of, rather than having kind of all around the country, everyone starting from scratch and kind of figuring this out, now there's some infrastructure where as these models are being built, they can learn and share from one another. And the other piece here is that because the GWEPs are located within a state and they're responsible for doing the necessary stakeholder engagement, they're already operating in the local space, and that's why it's a great resource for this. So now I'm going to pass it over to Jenna Kellerman, who's going to talk about the next phase of this work, which is building on this GWEP piece. So next slide.
Sure, thanks, Betsy. Yeah, and so just again to reiterate, that one of the main goals and the vision of the Moving Forward Coalition was to create environments where people really want to work. And so as we looked at some of the really key components, the key levers that we can press to engage people and to keep people in our organizations, we looked at things like labor supply and how do we get more people in the labor pool to select from. We looked at recruitment pipelines. How do we really build systemic partnerships to help people find jobs in our field and really to funnel them into our organizations? And then retention. How do we just keep people here? And as we look at data, that's really where we can have the biggest impact, is how do we really focus on retention? And so that's where Betsy's comments about apprenticeship and creating these career pathways, that conversation becomes really important. Sean, you can go to the next slide. We've really found that retention is key. As we dig into the data and look at the numbers, we see really high turnover in our field. And so unfortunately, without some kind of really big disruptor, that's where we will continue to go. So that's why this work is really important. It can become a disruptor in our field to help keep people in these organizations and to help professionalize and grow their skills to a higher level. As we look at some of the data that PHI has shared, thanks to Kezia and her teammates, we see that there will be about 1 million new caregiving jobs, added to our sector between 2021 and 2031, which is actually more than any other occupation during that time frame. And then when you combine that with turnover, then we're really looking at filling about 9.3 million jobs in the direct care workforce. Now, that's not all nursing assistants in nursing homes, certainly, but you can see that retention really becomes kind of a bigger piece of the pie than the recruitment tactics do. So with that, you can go to the next slide, Sean. The Moving Forward Coalition knew we really needed to focus on retention. And so our goal was to create this pathway, this career progression, so that nursing assistants want to stay in their role. And so that's where a lot of this conversation around the registered apprenticeships started to blossom within our group. And you can go to the next slide, Sean. So as we really started digging into apprenticeship and trying to figure out, well, is this the direction we want to go or not? There were a lot of benefits to apprenticeship. So one is just that it's a nationally recognized system. In order to train and find competencies, to train on skill competencies. Apprenticeships have been around a long time and have really proven that they're effective in those ways. We also know that apprenticeships offer portable credentials. And that's really been one of the major barriers in our sector, is that a lot of the trainings and staff development is done at the employer level, which, you know, on one hand is great because employers are taking charge and are investing in their staff. The problem is that it doesn't really carry any weight outside of your organization. So if you're ready to move on, if you're ready to try a new organization, if your partner is moving out of state and so you're going to, that coursework is no good anymore. And we've even seen situations where an employer has a really great, robust training or career ladder program within their organization, and new leadership comes in and the new DON or the new administrator doesn't support that any longer. And so you even might stay with your employer and have that coursework become meaningless. So apprenticeship can really, really help support that by taking the onus off of the employer themselves and really professionalizing it at that national level to create that portable credential that can stay with the direct care professional. And it allows for the development of national standards. Betsy kind of alluded to this earlier, that we've found that there are so many programs all over the country, and this team of people, we've been working in this area for a long time, each one of us individually, and we have been surprised at the number of career ladder and lattice programs that are out there. And there's so many programs that none of us knew about. And so in seeing that, we're noticing how many programs are really recreating the wheel. And so having this type of national standard through an apprenticeship program can help create some efficiencies, some standardization, so that we're not all recreating the wheel over and over and over again to do this work. And on top of that, replication is important because of the need for evaluation. We need to be able to prove out that the career ladders we're building are effective for the organization, that they are effective in terms of improving the quality of care, that they're effective in terms of elevating the professionalism of staff. And so if we focus too much on piloting new programs, we lose that ability to really evaluate the true effectiveness and know if what we're doing is making a difference. So all of those are really great reasons to focus on apprenticeship. And then Betsy also noted the infrastructure behind it is really key. So Sean, you can actually go to the next slide, and then why don't you skip to the slide after this one. So as Betsy noted, we are looking at partnering with the GWEPs, and especially through the GWEP Coordinating Center as a way to really collaborate across multiple states and to look at how we can standardize an apprenticeship program with caregivers. And so our proposed activities that we are hoping will be funded include hosting a stakeholder convening. And so this is where we'd be bringing together really anyone in the states, the participating states, anyone who would be impacted. So we'd bring together nursing assistants, employers, residents of nursing homes, regulators, policymakers, really anyone who touches this area of work together for a convening. Start to figure out, what do you need? What does it look like to have a career pathway? What coursework would be important to you, resident, caregiver, employer? What's going to make a difference? So we can help facilitate some of those shared learnings and resources between GWEPs. We can work with the GWEP Coordinating Center to develop curriculum, to access and then share curriculum so that we create that standardized coursework with resources and templates that everyone can use. Again, that standardization piece is so key. And then we also are proposing to provide a technical assistance component through a learning community. So bringing all those organizations together to talk and troubleshoot through the development phase of this work. The GWEPs have 5 years when they receive their funding. Should we receive ours, we'll have 3. So we really would be supporting that startup phase, the data collection, the curriculum design, and then the GWEPs will be launching likely more towards the end of their grant funding. And then, of course, part of this is to complete a process evaluation. So again, since we're only funded the first 3 years of the GWEP funding, we'd really be focused on how does our support work, help get people off the ground? Are the resources we are providing effective? Is the structure effective? That type of thing. So those are our proposed activities, and we so hope to be funded. And welcome any comments from the group on those as well. But with that, Betsy, I'll toss it back to you.
Yeah, sure.
We can go to the next slide, Sean.
Yeah, so why don't yeah, and great to hear we see comments from Shirley in the chat here. Great to hear that people have applied to be GWEPs, and we hope to engage the GWEPs in this work. So unless anyone has specific questions, I think we'll keep going, and then we'll certainly leave time for discussion at the end. So Kezia is going to talk a little bit about this other thread around the Medicaid incentive payment program. So Kezia.
Great, thank you, and hi everyone. Thanks for hosting us as part of this conversation. So if you could go to the next slide, please. This was a separate action plan that we developed under the auspices of the Workforce Committee of the Moving Forward Coalition, but it sort of it interconnects with the CNA Pathway program work that you just heard about. And I'll say a little bit more about why as we go along, but really it's about kind of it's about other things as well, but in part, how can states support and sustain career advancement opportunities, for example? Where's the money going to come from and how? And that's where we got into the Medicaid incentive payment programs as one possible mechanism. So the intention with this action plan was to explore and promote the use of Medicaid incentive payment programs to boost wages and or address other job quality challenges and staffing challenges in nursing homes, with a particular focus on CNAs again. And we started with 3 goals, which were to sort of learn more about these programs and develop a guide that we could share to kind of raise awareness and build knowledge about this particular financing mechanism. We also started out ambitiously, as one does, with additional goals of working with 1 or 2 states to explore how they might build workforce metrics into their existing incentive payment programs, and also to partner with CMS in trying to promote the uptake of these programs across more states. As we went along, we realized that there's more to learn and explore and kind of establish about what these programs look like, how they're being tested, what we're learning so far, and really focus on that knowledge building part before kind of moving full steam ahead with encouraging states to take up these approaches. So we really have focused on that, the research part, and on developing a guide that we'll be able to share, hopefully broadly fairly soon. But before I get there, I'll say a little bit more about what we're focusing on here. If you go to the next slide, please, Sean. Oh, and you have a few clicks, sorry. So what we're talking about when we talk about Medicaid incentive programs, that's great, thank you. These are also known as pay for performance or value-based payment programs, different terminology in different cases, and then sometimes it's sort of slightly different definitions, but largely it's about adjusting a nursing home's payment based on the achievement of key quality metrics. And we learned a lot about these programs, in particular from a 2022 review that was conducted by the Center for Health Policy Evaluation in Long-Term Care, which is a program of the American Healthcare Association. And in that review, they found 30 unique Medicaid incentive payment programs across 24 states, and 13 of those did have some type of staffing or workforce related metric in them. So as you can see here, there were turnover or retention metrics. There were metrics around the amount of hours per resident day provided by nursing staff, employee satisfaction, or even just response rate to an employee satisfaction survey, metrics around continuing education, and a few more. and rarely a focus on wages and benefits or compensation specifically as a workforce metric. And that's where the committee was starting from, was can these programs be leveraged to actually support a wage floor or wage progression potentially. So there was that review. There's a little bit of work from MacPac and a few others in the field. But what we did find largely was that there was not a lot of guidance or information about what types of programs are out there, how these programs should be built and structured, and certainly very little data on their impact. So how have they actually rolled out and how successful have they been? But one place that we have really learned a lot of sort of important insight is in our discussions with experts across states. So in addition to kind of desk research on this topic, we had a lot of conversations with both state level and national level experts to learn more about these programs. And two state programs really stood out. You've already heard a little bit about Illinois' program. And Sean, if you could go to the next slide, please. I want to highlight Illinois' example and also California. Those are two fairly recent initiatives that are sort of nursing home reform initiatives that include some kind of incentive payment program that focuses on CNAs in some way. So the Illinois nursing home financing model, new nursing home financing model, includes a base rate increase for nursing homes and then 3 optional incentive payments based on quality measures, staffing levels, and CNA wages. So that is why this one particularly caught our eye. And those 4 payment streams together amount to an average of $33 more per Medicaid resident per day, with, of course, a large or broad range there. And the payment scale, the CNA payment scale, which is our particular focus here, includes 2 payment ladders. One is an experience scale. So that is an additional hourly wage based on tenure in the nursing home field, not with a particular employer, but just length of time working as a CNA, up to 6 years. And then the other one is a promotion pay scale based on being promoted into advanced CNA roles. So that's where it dovetails very nicely with the CNA career pathway work that Betsy and others were speaking about. And then the other example that I wanted to highlight is California's nursing facility financing reform, or AB 186, which became effective last year. And that has an sort of a range of aims, including incentivizing quality care and emphasizing the critical role of the CNA workforce. And 2 of the 3 main program components focus on the workforce. That's the Workforce Standards Program, the Workforce and Quality Incentive Program, and the Workforce Standards Program. That first one, the WQIP, aims to improve staffing in nursing homes and some other outcomes using incentive payments through managed care. And the second one, the WSP, explicitly aims to raise the standard on CNA, not just CNA jobs, but nursing home jobs, with an emphasis on the lower wage jobs, including CNA jobs, by tying rate enhancements to job quality indicators such as competitive wages and other benchmarks. So I think both of these examples, Illinois and California, show us what is possible to sort of think about, to imagine and realize in terms of leveraging Medicaid incentive payment programs in nursing homes to achieve quality outcomes related to CNA jobs in particular. And so we found that really exciting, to be able to look to these examples and think about what we can extrapolate from the examples into more sort of generalized guidance. So if you go to the next slide, please. So what we're doing now is synthesizing everything that we've learned and distilling it into a guide that we can share. And clearly there's nothing here that's about it being a sort of one size fits all type of approach or sort of universal guidance, nor is it exhaustive guidance, but basically we've tried to distill considerations related to the development of these payment programs. And then if you click again, the design of the program, so how they're actually structured, how the metrics are chosen, and so forth. and then how they're implemented. And so we're sort of pulling out the lessons that we've learned through our research and through our conversations with experts in the field. I'm aware of time, so I'm not going to talk through what we're finding, but or what we're building into this guide, but I will just say, if you go forward, Sean, one slide, those are the implementation considerations, and then one more slide. I just want to really flag that we are in the last stages of putting this guide together. And after having conducted that research, had the conversations, integrated the findings, and we're hoping to be able to disseminate the guide by the end of the month, by the end of May, and to be able to use that as the basis for further discussions with states about what might be possible in terms of building out and leveraging these programs for positive workforce impacts.
Great. Thanks, Kezia. And I think, Sean, you can go ahead and go to the next slide. And I'll try to speak to this briefly so we can get our last presentation and get some Q&A. So I'll be presenting a little bit about the hearing that I participated in 2 weeks ago with the Senate Special Committee on Aging. It was titled "The Long-Term Care Workforce Addressing Shortages and Improving the Profession." And the chair of that hearing was Senator Casey, and there's ranking member Senator Braun. The witnesses consisted of a direct support professional who's Nicholas Smith from Philadelphia, an LPN who was Brooke Vogelman from TLC Management in Indiana, and then a community college VP, which was Dr. Matthew Connell from Indiana as well. And we'll just go to next slide. And just to let you know, and I'll talk about it a little bit more in a bit, this was kind of on the heels, I think that same day, Senator Casey had announced his bill or introduced the introduction of his bill focused on the long-term care direct care workforce. So just to let you know, this hearing was focused on improving recruitment and retention for the direct care workforce. And the direct care workforce specifically within this committee was focused on certified nursing assistants in general, as well as RNs, LPNs, and therapists. And this included people across long-term care settings, so the workforce across long-term care settings, nursing homes, as well as home and community-based and assisted living. So just my key points briefly was related to the issues affecting the direct care workforce, specifically low wages and limited benefits, not being able to make a living wage. These are things that we all, understand. Blind-eyed inequities, just recognizing that different groups experience these poor benefits and low wages more than other groups. Chronic undervaluation and demanding work environment, insufficient training, preparation, and growth opportunities. So these are things that we've talked about a lot, so I won't go into them in great detail at all. But then as far as solutions that I shared was 5 points. 1 point is actually missing here, but the first of which was to invest financially. So really those competitive wages and benefits, staffing standard minimums, also gave some examples such as the Medicaid incentive payment programs that Kezia just discussed and shared, provide robust training and development opportunities, talks about enhanced training programs, and then opportunities for career advancement, specifically related to what Betsy also just shared, as well as Jenna. Next was to foster a positive work environment through culture change, which in that I talked about just creating a respectful and supportive work environment, a place where people desire to be and work, empowering direct care workers and improving staffing levels. And just one thing that as I continue to say direct care workers, I want to recognize just kind of the controversy with the title of direct care workers and different terms that we're using, but this is what was used for this hearing. And then also just want to reiterate, I think Betsy for doing that at the beginning, that this testimony was provided in my role as assistant professor at NYU and not as part of the Moving Forward Coalition. So next was to focus on both recruitment and retention. Something that we, sometimes forget to talk about is the retention piece as we're talking about just addressing these shortages. So again, making this desirable workplace, equity at the forefront, and then also drawing on community and external resources when thinking about recruitment and retention. And then the last thing that's not here was planning for evaluation and dissemination. So evaluation in the aspect of understanding the satisfaction of the workforce that is currently in these positions, and assessing that as different programs and interventions and strategies are implemented, how is the workforce responding to that? And then also creating just more data on the workforce related to demographics, for example, and then sharing best practices as well. And just go to the next slide. So some key takeaways. What I really appreciated that this was a committee that was committed to these issues. They really wanted to learn and understand these issues and really improve those who are working in this space. So that was something that was, really lighted up my day to be there and hear a little bit more in that area. And then more focus, something that was kind of reiterated throughout, and then also just having a conversation with Ranking Member Braun afterwards, was this focus on replicating and scaling up current efforts on the local and state level. So, his concerns was just kind of the buy-in when it comes to asking for, more money or more federal support, really recognizing and highlighting what's already happening, on local and state levels that we can continue to share and scale up, and really leveraging those. So that's just something as we're sharing in this space to really just emphasize the importance of sharing the work that we're doing, especially what's working. And then the Long-Term Care Workforce Support Act may be promising to addressing many of the issues discussed as far as recruitment and retention efforts and changing culture within these settings, and increasing wages and benefits and addressing inequities. And I'll stop there. If anyone has any questions, I'm happy to answer as well. And all the testimonies are available online. And I think the last thing I'll say is that moving forward, did submit a statement on record on this hearing as well. I think, Kezia, we'll go to the next slide.
Oh, great. Okay, I'll just take a couple of extra minutes. I hate to follow that because that was just very impressive, Jasmine, that you fulfilled that role, and thank you for sharing it with everybody. Such an important moment. But I did just want to give you a quick update, putting on my PHI hat, because PHI is one of the core partners in the Direct Care Workforce Strategy Center. I just want to give you a quick update on the Strategy Center. So I'm sure that you're familiar with it, but this is a national center that's funded by the Administration for Community Living, or ACL, for 5 years. We're now in year 2 of the project, and there are 3 main priorities for the year. To develop an advisory group to really inform the work going forward, to disseminate robust resources through a national online hub and webinar series. And really the centerpiece of the work this year is providing technical assistance to states. And there are 2 distinct forms of TA that will be provided over the rest of the year through the end of this calendar year. One is the peer learning communities, or PLCs, and these will involve 4 to 6 states in each PLC that will be focused around a shared topic of interest. And that group, each of those groups will meet monthly every month, and then each of the states involved will also get a certain amount of individualized TA to help them follow through on a particular project. And then in addition, there's the intensive TA, which is for a set of individual states, 6 states, who will get up to 250 hours of TA to pursue from sort of start to finish in terms of what's possible in the time frame, a project of their selection. And the selection of states has now been announced. So it's Alaska, Colorado, Delaware, Indiana, New Jersey, and New Mexico. They all did a really impressive job of pulling together sort of interagency team to lead this work and a vision for what they want to do through this TA opportunity. They each pulled that together in a short time and rose to the top in terms of the strength of their proposal. But I believe that every state that applied will have an opportunity to engage in TA one way or another. And that work is really led by Advancing States and the other state associations. So the National Association, actually, I'm going to take me 2 minutes to read all of those state association titles, but they're there on the slide. And then PHI and the Institute on Community Integration at the University of Minnesota are core subject matter experts in that work, as well as other SMEs that are being brought in. So just to say, you can go to that website, acl.gov/DCW Center, to learn more about the center overall. And then if you go to that second link, you can learn about, you can see the 6 chosen states for the intensive TA and learn a little bit more about the projects that they've each proposed. So I think that is the end of our planned content, and we've left just about 5 minutes or so, I think, for some engagement if there are questions or comments from the participants. Or from you, Sean. I'll turn it back over to you.
Great. Thank you so much, Kezia. And let's see, has anybody been looking in the chat or the Q&A to see if we've had any questions? Let's see. Haven't seen much in there, but let me
Sean, I
sure.
can jump in just with one clarification that Betsy pointed out. We just want to make sure what's really important, we think, is that everyone who can advocate for and make noise about what you really care about and what you're passionate about and what's important to you, we believe every organization and individual should do that. As the Moving Forward Coalition, under our funding structure, we have some limitations just in terms of, we can't lobby for things. We cannot comment specifically on pieces of legislation. That's why, as Jasmine pointed out, she gave testimony on behalf of her work at NYU and the Hartford Center there. So our statement had nothing, it was not related to the legislative specifics. It was related to the overall policy issues related to the workforce shortage. So I just wanted to make that point, and anybody on the Moving Forward team can jump in as well. But again, a lot of our role is advocacy, and it's advocacy around education. Again, we educate people in states that don't have the level of knowledge or interaction with all of you that CSG does have. So again, I think just one of the big take-home messages here is there's lots of work that needs to be done. There's lots of help that states are looking for and appreciate, greatly appreciate. And we've learned that over the last 2 years. So back to you, Sean.
Thank you so much, Alice. And if we can get some questions going here, if anybody has any questions for any of our guests today, and we will be happy to put those to them. And let's see. So one thing I was going to ask about, maybe Kezia, can you talk us through what some of those individual states that are going to get the specialized technical assistance, what they're looking to be able to accomplish?
Sure. So there's definitely an emphasis throughout all of the proposals on interagency collaboration and comprehensive strategies and solutions. And I think that's what this opportunity really represents, is an opportunity for states to kind of sort of step up out of the silos a little bit and try to look at what are the workforce solutions that are needed across different payment programs or populations or settings of care, to really have more, and across sort of different agencies' purview, to have a more comprehensive and then hopefully a more impactful and sustainable approach going forward. So you see that sort of show up in different ways across the proposals. Certainly also an emphasis, a couple of other themes, an emphasis definitely on training, building out training and career development opportunities for direct care workers. I think we certainly see that in Indiana and New Jersey and New Mexico, for sure. There's a peer mentoring program element to several of the proposals, including Colorado and Indiana as well, I believe, possibly others. And then in a few of the proposals, also an emphasis on data. So better data collection, better data sharing across different authorities as well. And then recruitment is another piece that shows up in a few of the proposals. So really quite impressive, multifaceted type approaches. And again, really emphasizing more sort of coherent and comprehensive efforts as well.
Great. And we had a question in the chat. This person asking about, you mentioned that states have multiple local programs but are not often integrated. What are some key steps to begin to integrate innovations within a state? Can't
So
remember who.
I'll start and anybody else can jump in here. I know we're at time, but I would just say, you know, it's the examples we gave from Kentucky, Oregon, and Ohio that I would use. And again, also Betsy and others mentioned about California. And I know we have colleagues here from Michigan. You know, these are states where getting on calls literally every other week or every month and talking about the specifics, how to do something. How did another state do it? Who did they bring together? Who's the right contact person? It's literally boots on the ground, getting into it, rolling up your sleeves, call after call after call. It's, you know, it's those kinds of things. So I would just say, that's what I would add, and any of my colleagues can jump in here.
Very quickly add that it's a modest step, but it's one that is incredibly important, is sort of level setting around language and terminology to make sure that as you bring different efforts together, everyone's talking about the same things in the same ways. And it's remarkable how often we can find that we're actually talking past each other without intending to, just because each program has its own way of defining the workforce or the program or the population or so on. And so just critical to make sure there's sort of shared language in order to then think about building more integrated approaches.
Great. Well, we are just at time here, so I want to thank all of our guests for joining us today. And before we go, just a quick recap about future network meetings. Quick update. We are still hoping to schedule meetings for at least May and June, and we are exploring several possible dates and topics for those meetings. Unfortunately, nothing concrete to share on that front today, but I will send out an email to our mailing list with the link to register once we're able to confirm those. If you are not on our mailing list, shoot me an email. I'm at sloan@csg.org. Please check out our website, the National Online Resource Center at web.csg.org/long-term care. Send us any relevant bills or other resources that we may be missing on the website. And please reach out if you're looking to put something together like our friends in Hawaii did back in February. In June, it looks like I will be in Pennsylvania along with perhaps some of the other folks on this webinar. The Bucks County Health Improvement Partnership is hosting a long-term care summit for stakeholders and policymakers to identify some workforce solutions that could be effective not only at the county level, but that may also attract attention at the state level. So we look forward to that. Thanks again, everybody, for joining us. We will be back in touch soon with details about our future endeavors. In the meantime, don't hesitate to reach out with any questions or concerns. For now, I'm Sean Sloan at CSG headquarters in Lexington. So long.
Thanks, Sean.
Thanks, everybody.